Sussex that's struggling to cope at the moment. Stacey Poole joins us in the studio for more on this. And Stacey, this crisis being seen across the region, wherever you look really, including in Kent, of course.
Everywhere the situation is very worrying, that's what I can tell you. All hospitals have now told patients not to attend A&E unless there is an immediate threat to life, and I can't remember the last time that happened. Let's look at this in a bit more detail. Medway Hospital continues to face serious challenges, and CCAM declared a critical incident in the run-up to Christmas, and demand for ambulances remains high. Well, today doctors said patients need to realise just how serious the situation is.
I think there's a real crisis, and I don't think that this is apparent to many people. The fact that if you have a life-threatening illness right now, you may not be able to get life-saving care. You might not be able to get an ambulance in time. Emergency waits are very, very long, even for life-threatening illnesses, and people are dying every day as a result.
And it's not just hospitals feeling the strain. We reported on how bad the situation was in GP services back in December. Things are now even worse.
The health system at the moment is at breaking point. It is in a state of overwhelm that I have never seen before in terms of patient needs and in terms of workforce challenges. It is absolutely huge at the moment.
And Stacey, whichever way you look at it, the situation pretty worrying at the moment. Calls for help coming from all quarters. What are the government saying about what's going on?
Until today, they've said very little, but today the Prime Minister did say that he's acknowledged the pressures and he has pledged to cut waiting times. This is what he said.
You should know we're taking urgent action, increasing bed capacity by 7,000 more hospital beds and more people cared at home, providing new funding to discharge people into social care in the community, freeing up beds, and the NHS are working urgently on future plans for A&E and ambulances.
In response to that speech, the British Medical Association said we need actions rather than just words.
What the Prime Minister has been saying about waiting lists and how he will solve the problems in the NHS, none of that will happen without staff, and with our pay having fallen by almost a third in the last 10 years because of all these below inflation pay rises, we are really struggling to recruit and to retain staff, and that is one of the key things the government has got to get a grip on to solve the crisis we're in at the moment. We've got people being treated in ambulances outside A&E, we've got people in corridors running out of oxygen cylinders. You know, all of those things are the result of many years of choosing to underinvest in staff and underinvest in infrastructure.
Well, urgent action is desperately needed as ambulance workers are going on strike again next week.